I think sometimes we wonder what resources we have to bring to solve those problems. I mean, they're huge problems, and I'll say that recognizing first of all that Mayor, we live in a state that hasn't really prioritized mental health ever. I mean,
Mm, mm,
pre-pandemic, so we have this pent up need out there that hasn't been addressed before. But then on top of it, now you superimpose the just trauma really of going through the pandemic, and some of it is our response to the pandemic. As you mentioned, we've got people isolated and people who can't get together, and those are really problems that make it worse. But then the pandemic itself, we've lost now just under 20,000 Alabamians to this disease. 20,000, um,
mm.
and
Wow.
for the past year at least, since vaccines have been widely available, the majority of those deaths didn't have to happen. I mean, they're preventable,
Right.
and so clearly that plays a big role as well. We're going to have what we are starting to think of as a health debt that's going to have to be paid for years to come, and it starts with the mental health things that you talked about. But we've also had 2 years of kids not getting routine vaccinations,
Right. Right.
women not getting mammograms and pap smears like they normally would, people delaying going to get their heart disease managed, all sorts of things that people have put off or avoided or been unable to obtain. And that's a health debt that's going to have to be paid.